And joining us today is the Director of Breast Cancer Surgery at Hartford Hospital, Dr. Heather King, to tell us more about this surgery and its benefits. Doctor, thank you for being with us. We appreciate it.
Thanks for having me.
All right, first, what was the standard approach been for targeting tumors during breast surgery?
So the standard approach has been to localize a non-palpable finding in the breast or a high-risk lesion that needs to be removed. What's called a wire localization program. And it also is called needle localization. So the patient presents on the day of surgery to the radiology department first, where the wire is then placed by the radiologist into the targeted tissue for removal. They then go to the operating room, and then the surgeon uses that guide of that wire as a guide wire to remove the targeted tissue for excision.
Okay, so how does this new technology of seed localization make this better?
So the new technology, the seed localization, allows the patient to actually meet with a radiologist days, weeks, or even months prior to their surgery to have the special seed placed into the targeted tissue that needs to be removed. So this, most importantly, allows us to decouple the radiologist's schedule and the breast surgeon's schedule. Because if you can only imagine, two people's schedule is very hard to coordinate versus just having one. So this allows the patients then to have their surgery sooner.
All right, good deal. And so how does it work? Once the seed's in there, explain how that works now.
Yeah, so once the seed's placed by the radiologist, the seed gives off a special signal to a probe that the surgeon has in the operating room. The signal that it gives off is either by a radio frequency or magnetic. And once the patient is in the operating room under anesthesia and comfortable, and the incision is made, the surgeon is able to utilize that special probe to go into the breast and actually measure within millimeters of how far away you are from the targeted tissue for removal. I like to describe it as like kind of a little mini GPS system. So it's pretty neat. Which
is great, yeah. So you mentioned scheduling and how you can target this. Why is this method so beneficial for breast cancer patients?
So I think that really the new approach allows these non-palpable findings to be removed at the breast in a more timely fashion. And that's what we're really looking for. When a woman hears they have a high-risk lesion or a breast cancer, they want their surgery done, yesterday. So this really allows us to be able to open up access to their surgical care sooner.
Faster is better. Boy, it sure is. Listen,
faster is better.
There's more information. We'll link you to it from our website at WTNH.com. Dr. Heather King, appreciate your time. Thank you for being with us today.
Thank you again.